So with me today is Dr. Rakesh Varma.
Sure.
Sir is Professor of Cardiology and Additional Medical Superintendent at Safdarjung Hospital. Sir, today you have been a part of a debate for a major topic, that is statins for all.
Yes.
So can you just give a brief insight upon this topic, sir?
See, as you are aware, this conference is about cardiology, diagnostic and treatment. Dr. Anup, the best way to treat a disease is to prevent it.
Right, sir.
Fine. Among the various risk factors that we have, lipids have got maximum weightage, which is positive action. By giving statins, you can reduce the lipids and you can prevent morbidity, mortality and all complications of atherosclerotic heart disease or atherosclerotic coronary artery disease. As you are well aware, right from Framingham study onwards, there are n number of research publications which support the concept that to combat, to remove this disease, prevention by way of lifestyle measurement, stoppage of smoking, control of diabetes and by anti-lipid therapy by way of common popular statins is the best armamentarium that doctors, physicians and cardiologists have.
Right, sir. Sir, when we speak about the use of statins or the management of dyslipidemia, there are various guidelines which is from either European society or from the American society, sir. So, speaking about as a whole about the guidelines, sir, what would be the ideal LDL cholesterol levels which you see before initiating a statin management?
See, it's a very important question that you asked, Dr. Anup. I must say that there is nothing like ideal. The lower, the better. The lower, the lesser, the better. Right. But at the same time, if the patient, any patient having no previous history of cardiac disease or atherosclerotic disease, and if his or her serum triglyceride LDL levels are above 130 milligram percent, he is the right candidate or she is the right candidate to start with management of hyperlipidemia in the terms of body weight control, lifestyle management, giving up of smoking and possibly dietary changes and addition of statin.
Yes. Sir, during your debate you were discussing about the diabetic population, sir, and you were suggesting the use of statins for diabetics, sir. So should it be irrespective of the LDL level, sir?
Anup, again a very pertinent, very relevant thing you have asked me, and I am very happy to reassert that diabetic patients, irrespective of their age, their gender, their previous disease history or not, they all are at very, very high risk of developing atherosclerotic coronary artery heart disease. And they are the strongest candidate, stronger persons whom they must be given in a statin irrespective, I am repeating, irrespective of their baseline LDL levels. So, right, you must prescribe a statin to all your patients, that a diabetic patient, irrespective of his other risk factors, must be given a statin, and whether it is mild dose, moderate dose or big dose will depend upon individual situation. But one statin a day to all your diabetics should be the motto.
Right, and sir, for prevention of cardiovascular diseases, whether it is a primary or a secondary, sir, which statin would you like to prefer, sir? I mean, which you use, sir?
See, there is about 7 or 8 statins are popular and available in the Indian market. For this, a cardiologist and physician should depend on his own individual experience with the particular compound, and various companies manufacture and market this, and there is some minor differences. So one should stick to the statin on which you are confident, you are aware about the effects, side effects and other things.
Right, sir. And sir, when we speak about the Indian dyslipidemic patients, sir, hypertriglyceridemia is again a concern, sir. So would you change your management based on?
Say, no, basic management remains for LDL, small attention for triglyceride. In that, lifestyle management and fibrates may do a lot of wonders.
Okay, sir. Okay, so fibrates can be a definitely better add-on.
Definitely add-ons.
Okay,
but I still say once again very emphatically and clearly, all the diabetic patients, irrespective of the age group and gender, irrespective of the baseline lipid levels, irrespective of the LDL levels, must get benefit out of a statin by a prescription by a physician, cardiologist, surgeon for a long-term use so as to prevent atherosclerotic heart disease.
Right, sir. I think you have given a very valid point, statins for all. Sir, again, one more thing what I wanted to ask you, sir, with respect to the statin therapy, sir, is creatine kinase level estimation and rising CK is a major concern?
See, that is a concern, but not that big a major concern. When we are speaking from a public forum, we should focus on positivities. If we go for negativities, people will focus only on negativities, which may not be in 1 in 1000 or maybe insignificant. That's why I did not ponder on those points. I come on to be on a positive aspect. I repeat, they are very safe and any side effects cannot outweigh the benefits of a statin.
Right, sir. Sir, thank you for your valuable input, sir.
It was a pleasure to be with you.